Our health service is regularly rocked by scandals that have, in many cases, cost patients their lives. And all too often, these stories reveal that staff who did try to draw attention to problems were silenced and even persecuted. Like Shamila Chowdhury. When she reported she suspected fraud in her hospital's X-ray department, she was the one suspended.
I was actually escorted out of the building in front of all my staff. I was humiliated, really humiliated. It was quite distressing that that people were starting to think, had I done something wrong?
Shamila won her employment case, but her career and her health were destroyed. Her experience helped prompt the review published today. A survey of staff by the review team found 30% had raised a concern about suspected wrongdoing in the NHS. But among those whistleblowers, 30% felt unsafe in their job afterwards, and 17% reported being victimised by their managers.
It's patients who are at risk, and sometimes lives can be lost and avoidable harm occurs. So that's why it's important. But equally, it can be about money, or it can be about dishonesty. If those who know about these things don't alert the authorities to it, wrongdoing continues. These are very important issues.
Sir Robert's recommendations include having a person in every hospital for staff to turn to if they want to speak out, and setting up a scheme to help whistleblowers who do lose their job to find new employment. As he accepted the proposals, the Health Secretary announced a new law to protect whistleblowers will be fast-tracked through Parliament.
The message must go out today that we are calling time on bullying, intimidation and victimisation, which has no place in our NHS.
So at the highest level of government, the voice of the whistleblower has finally been heard. But every corner of the health service now also needs to learn to listen. Catherine Jones, 5 News.